Most people think health checkups are always a good idea. But what if I told you that after a certain age, some of them could actually put your life at risk? It sounds strange, I know. But the truth is, not all screenings and tests are harmless. In fact, some of the most common checkups offered to older adults may lead to false alarms, unnecessary stress, and dangerous procedures. That's not fear-mongering. It's something more and more doctors are beginning to acknowledge, especially when working with patients over 70. The medical world is waking up to a new reality. One-size-fits-all testing can do more harm than good as we age. In this video, we're going to take a close, honest look at 5 specific health checkups that seniors are better off avoiding, screenings that even experienced doctors often turn down for themselves. We'll explore why these tests are so commonly recommended, the hidden dangers they carry, and the better alternatives that keep you informed. Without putting you at risk, you deserve medical care that respects your age, your body, and your quality of life. If you're someone who cares deeply about your health, but also wants to avoid being overtreated, over-medicated, or overwhelmed by today's healthcare system, this video is for you. We're not here to scare you. We're here to empower you with knowledge, confidence, and a clearer picture of what truly supports your health after 70. Let's begin. Number 1, the colonoscopy trap. Colonoscopy has long been considered a gold standard in preventing colon cancer. But after age 70, especially in people without symptoms or family history, this test can quietly become more harmful than helpful. What was once a life-saving screening in your 50s or 60s can, past a certain point, turn into a source of unnecessary risk, stress, and even hospitalization. Why? Because the procedure itself is no small matter. It involves full bowel prep, sedation, and the insertion of a scope deep into your intestines. That's taxing enough for a younger adult. But for older adults, the risks go up significantly. The bowel cleansing process alone can cause severe dehydration and electrolyte imbalances, both of which are dangerous in seniors. And the sedatives used during the procedure can linger longer in an older body, leading to confusion, dizziness, and an increased risk of falls. But there's something even more concerning. Many older adults, especially over 75, are subjected to follow-up surgeries or treatments after a colonoscopy finds small polyps that may never have caused harm in the first place. These slow-growing abnormalities often take 10 to 15 years to develop into anything serious. And for someone in their 70s or 80s, those years may never come into play. Yet the discovery creates fear. It sets off a chain of procedures, biopsies, repeat scopes, even partial bowel removals, all in the name of prevention. But when the risks of these interventions outweigh the benefit, prevention becomes harm. Here's an example I'll never forget. A friend of mine named George, 82 years old, active and sharp as a tack, was talked into getting a routine colonoscopy, even though he hadn't had any digestive issues. During the prep, he became severely dehydrated. After the procedure, he was groggy and confused, fell at home that night, and fractured his hip. That one test led to months of rehab, medical bills, and stress. And guess what? The scope found nothing. This isn't about blaming doctors. They're doing what they were trained to do. But medicine is evolving, and we have to evolve with it. If you're over 70 and not experiencing any symptoms, it's perfectly reasonable to say no to a colonoscopy. There are non-invasive stool tests now that are safer, easier, and effective for many. It's about weighing the true cost, physically, emotionally, and financially, of putting your body through something that may not actually help. We must stop assuming more testing always equals better care. Because after 70, better care often means fewer interventions and more thoughtful choices. You're not neglecting your health by being cautious. You're honoring it. Number 2, the annual full-body scan mistake. There's something seductive about the idea of a full-body scan. Having a machine look through you from head to toe, uncovering every hidden issue before it becomes a problem. Sounds like smart prevention, right? But for seniors over 70, this approach can be more of a curse than a blessing. While the intention behind full-body scans may seem proactive, the outcomes they produce often set off a domino effect of fear, invasive tests, and even unnecessary surgeries that can shorten your life, not lengthen it. Let's be clear, full-body CT scans and MRIs aren't your typical screening tools. These are powerful technologies designed to pick up everything. And I mean everything, including harmless abnormalities that would never affect your health or lifespan. These so-called incidental findings can turn into ticking time bombs in your mind. A small nodule here, a shadow there, and suddenly you're on the merry-go-round of follow-up appointments, biopsies, and specialists, all chasing something that might never have mattered. Why does this matter more after 70? Because the older body doesn't respond the way it used to. A biopsy that would have been simple at 45 can now lead to a collapsed lung, an infection, or weeks of recovery. Even something as routine as lying still. For an MRI can be physically exhausting or painful for older joints. And the emotional toll is something many don't talk about. Seniors often carry the burden of worrying about what might be rather than enjoying the health they actually have. Take the case of Betty, a 78-year-old woman I met during a senior health seminar. She was vibrant, walked every day, and had no complaints. But during a health fair, a mobile clinic offered her a discounted full-body scan. They found a tiny lesion on her kidney, so small. It hadn't caused any issues and likely never would. But the word lesion was enough to ignite panic. Within a month, she was in surgery. The aftermath, months of recovery, a drop in energy, and lingering complications that never quite went away. All for something that might have remained silent forever. Medically, it's called overdiagnosis. Emotionally, it's called unnecessary fear. And financially, it's draining. Full-body scans are rarely covered by insurance. Unless there's a clear reason, many seniors end up paying out of pocket, thinking they're buying peace of mind. But what they're really buying is a ticket into a system that may never stop testing. But responsibility in this chapter of life looks different. It means trusting your body a little more. It means listening to how you feel, not just what machines say. And it means recognizing that not every shadow on a screen deserves your energy or your fear.